Welcome to Health 2.0. Let's talk a little about the history here in the healthcare of the U.S. Before the 1920s, doctors didn't know very much about diseases to really provide any kind of useful healthcare, and therefore it didn't change very much. Only large employers provided some form of health insurance, and everybody else just kind of paid out of their pockets. However, as the knowledge kind of grew, so did the costs. Enter Baylor Hospital, founders of the Blue Cross and Blue Shield health insurance, not-for-profit. So soon after World War II, healthcare started to get into kind of a boom. More and more private organizations got into the healthcare business, and it was more commonplace for workers to receive health insurance benefits from their employers. The government also provided tax incentives to do so. However, it became very apparent that there were some problems with this. Poor day laborers and self-employed workers for small companies had little to no health insurance. Also, after the insured workers retired from their jobs, they lost their health insurance benefits. This is where Medicare and Medicaid came into play. In 1965, President Johnson signed the Medicare Act. There was two parts. Part A covered hospital services. Part B covered doctor services. This further evolved into two types of Medicare. Medicare Original and Medicare Advantage. Original is provided by the government, and Advantage is provided by private insurance companies contracted by the government. By 2001, Medicare and Medicaid has made up 32% of all healthcare expenditures in the U.S. The problem with it is it's a large system that isn't designed to achieve the outcomes beyond paying beneficiaries' claims. So what does this all mean for Health 2.0? Well, with such a high cost in healthcare, people are looking for other ways to minimize their costs. One of the key tenets of Web 2.0 is that of content. This is which the users themselves operate as co-developers. Many health professionals worry about the risk of poor user-generated content on the unregulated internet. Of the 81% of internet users in the U.S., 59% of them looked up healthcare information online, and 33% of those diagnosed a medical condition before ever entering into a doctor's office or healthcare provider. So, one of the big things in healthcare is this generation of transaction data. This includes electronic medical records, documentation at a doctor's office or a hospital. Now, the biggest issue they have is that there's no connection between transaction data and the content. There's plenty of tools that are used in Web 2.0, but this transaction data isn't really transparent to them. So they're starting to see a rise in transparency of this transaction data. So this feeds into the Health 2.0 regeneration cycle. The very first part of the cycle is user-generated healthcare. This is where content's generated by the users via the forms of blogs, websites, other Web 2.0 tools. This in turn allows the consumers to connect to the providers. This is where the transaction data is starting to be transparent for the users. This in turn allows partnerships to reform how health insurance is delivered. And because of this, this change in the way insurance is delivered, users are seeing more of their data returned to them, which allows them to make more decisions, which allows them to make more discoveries, which allows them to, again, generate healthcare information. Now, John will talk a little bit about some of these Web 2.0 tools.
Let's talk about how Health 2.0 is being used. Here's some examples of a couple of web services that there are out there. The most common and powerful way to share information is the use of social networks such as Facebook, Twitter, and MySpace. People always look for other people's opinions, so this is a good medium to communicate with each other. The downside is that it's not everybody's an expert, so you don't really seeking for the best advice. I'm gonna give you some examples where you can actually look for professional advice for any health related issues. This is a way to seek for the best doctor out there in your area. RateMDs.com offers you all the background and information about the doctors in your area. You can check by zip code and name of the doctor, even hospitals. So this is the best tool to seek for the best professional help out there. Another way to look for information is through this website called Mepedia, which is like the Wikipedia for medical related issues. This is fantastic for groups and sharing documentation where everybody can contribute. A very popular way to share information is through blogs. Here's two examples, like WebMD's blogs and the pump handle. Medical experts post blogs and useful information about any type of health related medication, information, and issues. And also they can review and post information about health covered plans that are out there, which is very popular. Talking about health insurance, let's talk about some web service that is very popular but it's not getting a very good reputation to Health 2.0, and that is healthcare.gov of the Obamacare website. The downside is that it's always been down, so it cannot really handle all the thousands and millions of applicants every day. The website could only handle 1,100 people or users a day before launch, so they didn't really test it very well. The website repeated crashes where the errors show in these slides, where is suspected because of the high traffic with this website. The developers trying to pull some monitoring tools for the healthcare.gov website to improve the user experience of the site. Also, they're working really hard to make it better and useful for the user, since this is the way that people are seeing Health 2.0 these days. But hopefully they get it done at the end of the month, because people are waiting for the deadlines. Although healthcare.gov has gotten a very awful publicity, could be, once launched correctly and start working properly, it's gonna be a good advantage for all the users for a quicker way to seek for insurance and healthcare. But they have to get it done by the end of the month in order to work properly. And could be the beginning of a useful way to do Health 2.0 on the website.
Now we encounter the question of what is the future of Health 2.0 and how will it impact society? While the national debate continues about Obamacare and how to reduce healthcare expenses, New York has already taken action. New York is building a digital network of electronic medical records that will change how patient care is provided and deliver major cost savings. It's called the Statewide Health Information Network of New York, or SHINY, which puts New York far out ahead of all other states when it comes to health IT. Imagine if you were seriously injured in an accident and you couldn't tell the medical staff in the emergency room about any pre-existing health conditions. With electronic health records, doctors can have immediate access to your complete medical history. This can make a difference in the outcome of your care. How many of us have gone to a doctor's appointment and filled out questions about our health and then gone to another doctor's appointment at a different location and have been asked to answer the same exact questions? With electronic health records, your doctors will be able to view a complete medical record in seconds, so you would not have to answer questions over and over again. Electronic health records could also reduce the number of unnecessary repeat medical tests because your doctors could see in your record that you recently had the same test and be able to check the results. This can dramatically reduce costs. Shiny is a secure electronic health system that will allow accurate and efficient flow of patient medical and billing information. Now, there are other ways that Health 2.0 is advancing, and that is in the use of phone applications. First, we have the Walgreens mobile app. This application allows people to refill their prescriptions in under 20 seconds by simply scanning the barcode label on their prescription bottle and selecting a local Walgreens for pickup. It allows for prescription transfers from different pharmacies by taking pictures of the prescription label. Another useful feature on this app is the pill reminder, which also lets you set up helpful reminders to help you keep on track with all of your medications. Another app is Zio Mobile, which helps you measure your sleep quality at home by connecting to an iPhone or Android device that allows you to see your deep sleep and REM sleep to help you understand what is going on in your sleep. The app works on measuring your sleep quality by using a lightweight headband that requires 2 hours of charging before you use overnight. The headband can then be connected to your phone via Bluetooth. Online, it suggests ways that you can improve your sleep, like reducing caffeine intake or changing the lighting in your bedroom. And the final application I want to talk about is called My Calm Beat, which is a stress reduction app. It comes with an ear clip heart monitor, which first calculates your personal best breathing rate where you are most calm, and then provides tools to help you train by breathing at that rate. Your breathing rate affects your heart rate patterns, which affects how your brain deals with stress, and all of these processes are tightly interconnected. While it's difficult to directly control your heart rate or your brain functions, you can control your breathing rate. By regularly slowing your breath down, you can improve your heart rate variability, which will allow your brain to effectively deal with stressful situations that you encounter. We thank you for listening and hope you enjoyed Health 2.0.